Hello and welcome. I'm Vivian Sisskin. I'm from the University of Maryland, College Park, Maryland. I'm a clinical supervisor there, and I have the pleasure today to talk to you about group therapy for stuttering, one of my passions. And so I think it'll be a lot of fun. We're going to see how it works, some of the nuts and bolts of therapy, and some of the framework for group therapy. So first of all, I want to tell you that some of the literature in terms of outcomes, particularly from the area of psychotherapy, shows that group therapy is at least as effective, if not more effective, than individual therapy in many cases. It's also more efficient in that it's cost effective and uses less clinician time. But that's not the reason I do it. I do it because it has wonderful outcomes for people who stutter. I work with children in groups as young as 8, 9, 10, a tween group. We work with teens in group, and we work with adults in group. And so I'm here today to share with you some of the strategies for working in groups for stuttering, and to share also a model of how this is carried out in a specific form of therapy called avoidance reduction therapy. When I first started out as an undergraduate at UCLA many years ago, many years ago, I had the pleasure of working with Dr. Joseph Sheehan, who was a psychologist at the time at UCLA. He was there from the late 40s to 1983 at the time of his death. And he was a psychologist working in the area of stuttering. He made many contributions, including the notion of avoidance reduction therapy for stuttering. And through his psychology work, he did a lot in the area of role conflict and approach avoidance conflict. So he did a lot in the area of conflict theory, which informed his treatment model to a great extent. I'm going to share a lot of that with you today and show you some clips on how this is actually carried out. Okay, so here we go with our purpose and overview today. I'm going to describe the benefits of group therapy for the treatment of stuttering in adolescents and adults. I'm going to provide a framework for executing group therapy and applying clinical methods. So I'm going to actually be talking about the clinical skills of programming, data collection, feedback, and reinforcement within the context of group therapy. And I'm going to present avoidance reduction therapy for stuttering as a model or an example in order to illustrate these concepts.